Let me give just yes, no on this. Are we spending too much time on an internal enterprise data warehouse and big data strategies? Are we spending too much time there or not enough time?
It depends. Because if you have a warehouse, make sure it's clean and providing necessary relevant data, but at the most routine level that it needs to. Let it provide base level important information now versus data lakes of information. Make sure the data you have is usable and clean.
Yep, absolutely. So are we spending too much time on the EHR?
Yes,
Are we spending too much time on population health?
it depends. So I would say yes if you don't have an ability where you can manage risk lives appropriately and have a strategy really defined. Because if you don't have the ability to manage the entire risk population, the entire journey of that patient's continuum of care, then you're going to be in a sticky wicket.
Great. So yeah, and you mentioned AI and machine learning. Are we spending too much time there, or we're just talking about it now? We're not really spending a lot of time on projects.
We're talking about it. In some cases, it's there. Like when you look at being able to bring Alexa into the patient room and be able to take some of that time off of nurses and say, "Hey, I need a blanket. Hey, I need to use the restroom." There are some cool use cases, but it goes back to again, it's those Maslow's needs that are going to be covered by those technologies first.
Yeah, I had a great discussion with Patrick Anderson this week, and we were going back and forth on the use cases of AI and machine learning. Take a look at Ochsner; they're doing some interesting things, and
Mhm.
take a look at UPMC, obviously, both of which are doing some interesting things with Microsoft. And then 2 weeks ago, we talked to Halamka, who was doing some interesting things on the AWS cloud.